Hello and welcome to the program Healthy Living on Trust Television. I'm Aisha Salihu. Bones are often thought of as static structures which only offer structural support, but studies and functionality have shown that they make up an organ in the body. Like other organs, bones are valuable, and besides providing shape to the human body, bones permit locomotion, motor capability, protect vital organs, facilitate breathing, play a role in homeostasis, and produce a variety of cells in the marrow critical for survival. But bones are said to continually undergo structural and biological change, and remodeling of bone continues throughout life based on the demands placed upon them. How then do we ensure safety repairs when these bones get involved in accidents or any events that put them at risk and make them unable to deliver their primary function? On this episode of the program, we'll take a look at incidences of bone fractures and dislocations, and perhaps with the resultant bone infection, otherwise known as osteomyelitis. I have joining me live via Zoom from Reddington Hospital in Victoria Island, Lagos State, Dr. Babajide Lawson, who is a consultant orthopedic and trauma surgeon. Welcome to the program, Dr. Lawson, and thanks for joining us.
Thank you for having me.
Good. So let me start off our conversation with a background knowledge on the different types of bones in the human body. I mean, the type of bones the human body possesses, both adults and children, irrespective of gender.
Okay. I think your introduction was beautiful. It captured bone, and you really talked about a lot of things that comes up with bone that we may not be aware of. But essentially, if you want to talk about the types of bones, the simplest classification would be into whether it's a long bone or a short bone. An example of the long bones would be the bones in the arm, that's in the humerus, okay? The bones in the forearm, those are all long bones. Bones in your legs, your thigh bones, your leg bones are long bones. The bones that make up the skull are what we call short bones. So that's one very brief classification that tends to cover for a lot of things.
Okay, I got you correctly. You did talk about long and short bones in the body, but then what would you say are the clinical significance of the type of bones in the body? What are the clinical significance?
Oh, beautiful. So essentially, like we highlighted earlier on, the bone is one of the work it does is serves as one of the sites for production of blood, the blood cells. So we'll talk about the red cells, we'll talk about the white cells, which is for defense, the red cells for carrying oxygen. And this, the bone marrow continues to do this for most of your life. Of course, as we get older, the marrow gets to be replaced by yellow, by fat, yellow marrow, and only the upper parts of the arm bone and the thigh bone retain that capacity for the rest of life. Of course, the spine also does that. And the implication is that in certain conditions, cancerous conditions where they spread to bone, these are the particular areas of the body that get to be involved. So there are certain conditions, what we call hematological cancer, such as multiple myeloma, that can affect the spine as well as the upper portion of the humerus and the femur. And there are some cancers that do metastasize, that is spread to bone, and it's these areas with active marrow producing cells that are affected.
Okay, but then we're talking about bone fractures and dislocations. What are the most common causes of bone fractures and dislocations?
Okay, very good. So the thing is, for that, a fracture, simply put, is a break in the continuity of the bone. So once the continuity of bone is disrupted, that is a fracture. A dislocation is a disruption of the joint. So a joint is where two bones come together. So like in your shoulder, you have the ball and the sockets coming together this way. So anything that makes the ball come out of the socket will constitute a dislocation. So let me take that again. Anything that leads to the disruption of bone will constitute a fracture. Anything that leads to disruption of a joint will constitute a dislocation. Now, having said that, knowing the strength and the way of what bone is, it would suggest that you need a certain amount of force to result in a fracture. So road traffic accidents, falls from heights, anything that can impact a significant amount of force to the bone can result in a fracture. The same applies to the joints. So there can be a dislocation when a person falls and lands awkwardly in a position that can tear the ligaments holding the joints together. Now, in some cases, the fractures can occur as a result of a trivial force, meaning somebody can just be walking, slip, fall down, and have a fracture. In those kind of situations, we call those a pathological fracture. That means that the bone ordinarily is unhealthy. So if it's not healthy enough, any small interruption, any small disturbance can actually make the bone fracture. And the pathological fracture can result, one of the commonest things that can result in a pathological fracture would be a cancer of the bone, one. Two, an infection of the bone. Osteomyelitis can result in a pathological fracture. One other thing that can cause it would be a situation whereby the bone is weak due to a deficiency in vitamin D, which is a very important mineral that plays a role in the homeostasis that you mentioned with respect to calcium metabolism within the body.
So what then would you say are the significant symptoms to be noticed, and how are bone fractures or dislocations diagnosed? Because I understand that some people may not even be aware they have suffered a bone fracture because they don't really identify with the symptoms. They do not know these symptoms. So what are the significant symptoms to tell one, okay, now you have a bone fracture or dislocation? Let's stay with bone fracture. Okay. And how can this condition be diagnosed?
Okay, one, unfortunately, one of the things about a fracture is that it probably is one of the most painful conditions a human being can experience. So one of the things characteristics is pain. There may be swelling. If it is a fracture that is involving any of the bones that you use to move around, the leg bones, ankle and stuff, there usually would be some degree of loss of function, meaning the person will be unable to walk. Now, in some situations, like you mentioned, people may not be aware that they have a fracture, and that usually would be in things like maybe fractures of the toe, small toes, because after the initial pain, it's such an innocuous injury that people tend to overlook it and assume, oh, it's just a bruise, I don't think it's a fracture. The same would also apply in children who tend to, because of the elasticity of their bones and the high cartilage content, tend not to have their bones break like the ones of the adults. So it tends to undergo more of a bending, what we call a plastic deformation. So it just bends rather than breaks. And so what you now have is an incomplete break. The child may have some pain, but children, being what they are, quickly kick it. Just get back to playing, and you may notice there will be swelling. They may limp, but they probably would walk. So it's the persistence of the pain and swelling that may draw your attention to it, that there's a fracture here in this person. Now, if that happens, please get the person to a hospital where they can now get an x-ray where you can properly diagnose and assess to say, oh, there is a fracture and this is the type of fracture, the extent of the injury, so that you can plan what treatment you're going to offer the patient.
Let's say in an event a fracture is not immediately attended to, which fraction would you say are most likely to have, to result into complications?
Oh, very good. Lovely question. You see, the thing is, so a fracture of the thigh bone, that's the femur. Now, one of the things there is that the bones are covered by muscles. So the thigh bone can have a fracture and you can lose up to 2 or 3 liters of blood. Now, to put that in perspective, an adult male would have about 5.5 liters of blood. So you can lose up to half of your total blood volume just from a femoral fracture. That's a fracture of the thigh bone. So you do see the importance of it being quickly attended to, so that the doctor gets to see you, assesses your blood level, and is able to intervene if there are signs that you are losing blood. Another type of fracture that could be problematic is what we call an open fracture, in which case the bone is exposed or there's a wound communicating with where the fracture is. So a person could be knocked down by a car or a motorbike, and then you see the bone sticking out. Now, that kind of fracture usually would signify a significant amount of energy transfer to the bone, which would suggest damage to that particular part of the body, as well as other organs of the body that can be affected. It increases the chances of there being an infection because it's an open fracture. So the debris and things from the outside can get into the bone. And taking care of bone infection, osteomyelitis, can be very, very difficult to do. Yeah.
So we've talked about types, and we've also looked at symptoms and diagnosis procedure. Now let's move on to treatment. Regarding treatment procedures now, what are the modern technologies or advancements in medicine that are now in place to ensure that victims of fractures and dislocations attain ease?
Okay. So the thing is, the first portion is recognition of what the problem is, identify the fracture, and the first principle is to save life before limb. So you want to ensure that there are no other life-threatening injuries in this individual. And so that would now involve so many state-of-the-art things like the CAT scans, the CT scans, the MRIs, the ultrasound for trauma cases, the FAST, we call it FAST, ultrasound for trauma, so that you're able to assess, is this person having an injury, something that could potentially kill them. Once you've cleared that, the next thing would be to move on to taking care of that fracture. And there are various modalities, treatment options that will involve the use of something as basic as plaster of Paris to to retain the fracture after it has been aligned by the doctor. So the alignment may be done in the emergency room, in which case you just give a light sedative and get the patient relaxed. That also applies to a shoulder dislocation or hip dislocation. Get some light relaxation, and then you put the joint back in place. So once it is aligned, you can use something as basic as POP, or the patient may require surgery, in which case things like devices such as intramedullary nails and plates, screws can be used, metallic implants anyway, just to hold the bone pieces together so that you are able to get the patient back on their feet and back to their normal lives.
So I understand you just stated out treatment, but what is your take on people who still patronize the local and traditional methods, which many have tagged more accessible, affordable, and at most sustainable?
Okay. As with anything that is not properly regulated, you cannot hold these individuals accountable for their actions. So the challenge is that people will patronize them, yes, until we make access to care readily available, affordable, and like I said, accessible. Now, the second thing there would be that to also make people realize and hold the traditional bone setters accountable for their actions. So when they see that these individuals are mismanaging cases, they can be held liable for what they've done. But more often than not, they tend to go scot-free, and then we end up cleaning up the mess that it makes. So I would not recommend you going to see a traditional bone setter.
Thanks so much for your contribution. Bones can enlarge or become smaller, grow strong or weaker, and break when subjected to the application of excessive force. In the event of damage, they are one of the very few organs in the body that can regenerate without an obvious scar. There are typically around 270 bones in human infants, which fuse to become 206 to 213 bones in the human adult. The reason for the variability in the number of bones is because some humans may have a varying number of ribs, vertebrae, and digits. They vary in size, shape, and strength to respond to the demands of performing delicate or gross motor tasks. We'll take a quick break now to look at the practice of traditional bone setting in Kano State. And when we return, we'll continue with our conversation with Dr. Babajide Lawson. Don't go away.
The practice of joint manipulation and treating fractures date back to ancient times and has roots in most countries. These early bone setters would treat fractures with wooden splints wrapped in bandages or made a cast around the injury out of a plaster-like mixture. Over the years, this practice has proven to be effective and reliable in the treatment of bone-related injuries. I have treated over 1,000 people, and I have reset the bones of over 1,000 people. You see, there are different types of fractures, but for us here, when you come with fracture with bones outside, it doesn't scare us. Dantala Ahmad in Kano has been in this practice for over 70 years. He inherited the practice from his parent and is now passing same to his children. All these are my children, and we are over 20 in this house. And believe me, there is no fracture that scares us. Everybody in this house can reset your bone. And whenever you bring it here, we will do our best to make sure that your leg or your hand or whatever, any part of your body that got dislocation, we reset it. Traditional bone setting is a type of a folk medicine in which these practitioners are engaged in joint manipulation. Before the advent of modern medicine, these bone setters were the main providers of this type of treatment. They practice without any formal training in accepted modern medicine procedures. They also reduce joint dislocations and reset bone fractures. You see, I don't have any formal education, but there are so many hospitals in this Kano that do ask me to go to their hospital and be practicing. But I refuse. I told them my father asked me to practice at home, because if I go to the hospital, somebody that's supposed to give me 5,000 naira, the hospital authorities will ask that person to pay 100,000. Since when I was a kid, if they bring somebody with dislocation or fractures, our parent will ask us to watch and see how they are doing it. And gradually, we equally learned how to do it. And today, that is our main source of income. Although the practice of traditional bone setting still exists among communities in northern Nigeria, but these people say the lack of attention by government authorities is threatening their age-long tradition, which would have otherwise reduced pressure on the overcrowded modern healthcare institutions. You see, I do admit people here. Sometimes we keep people here. People will stay here for 2 months, 3 months, 6 months, up to a year. When they recover, they will go home. But the problem is that we don't have enough facilities to be admitting people here. As old as this practice, to date, people still troop into traditional bone setters for treatment and often regard it as the most reliable and less cost-effective compared to the modern orthopedic care.
Welcome back. If you're just joining in, this is a program Healthy Living on Trust Television, and we have been sampling perspectives from Dr. Babajide Lawson, who is a consultant orthopedic and trauma surgeon at Reddington Hospital, Lagos State. Thanks for staying with us. So now, we talked about osteomyelitis earlier in the program. Now, osteomyelitis always comes up when talking about certain bone conditions. But how does this occur?
Oh, okay. So osteomyelitis is an infection of bone. Is also the orthopedic surgeon's nightmare. You don't want to have patients having an infection of the bone. And this can come about through a number of possible ways. So in children, it tends to come via what we call through the spread from the bloodstream. So the child may have an infection, and that infection may now settle as the body supplying blood and tissues. It may settle in a particular bone and then become a point for infection. This usually tends to happen in kids that have compromised immunity. So you may see this in sickle cell disease patients. So that is one possibility. So children that are poorly nourished may also have this, and that is one way in children. Now, another way this can happen would be in an open fracture, where there is inevitable soiling of the bone because it has been robbed of its natural envelope of muscle and skin. So that is another possibility. The third possibility would be as a consequence of a surgical intervention by a doctor. So either during the process of taking care of a fracture, the surgeon may inadvertently contaminate or make that area become infected, and that can lead to a bone infection. So those are the three common ways in which a patient can develop osteomyelitis.
As an infection of the bone, how critical can they get, and how does one prevent its occurrence?
All right, so let me start from the easiest one to manage would be, first of all, you do not, bone infection is very difficult to manage. Unlike other types of infection where you get to take antibiotics, bone doesn't get very few antibiotics that penetrate bone well enough in the right amount of concentration to be able to take care of an established infection. And which is one of the problems whereby it's difficult, you don't want to get there in the first place. Now, having said that, it goes to say that the easiest to prevent would be the one that is the type of bone infection that comes by the doctor. So, of course, following all the regular protocols, all the protocols to ensure sterility and making sure that the operating environment is clean, well preserved, the patient is well prepared, and things they are using are adequately sterilized, so that they do not become a focus or a nidus for infection when the implant is put in the patient. So due diligence and meticulous care of tissues is very important on the doctor's part. Now, for children, that is a bit more difficult to prevent, All it takes is that if the child is sick and there's a suspicion of that, the child comes to the hospital on time, gets to see the proper specialist who, with a high index of suspicion, can start treating the child on time. Now, if the child comes in on time and you start out the appropriate antibiotics on time, you're able to nip it in the bud before it becomes established in the bone. So you kill it off before it can become a problem. As for the condition in sickle cell disease patients, it's just basic care, basic routine care. Avoid stress, be well hydrated, and so that you can avoid crisis situations.
I'm afraid we're out of time, but what are your final words regarding incidences of bone fractures, dislocations, and resultant osteomyelitis?
Oh, good thing is that osteomyelitis is becoming a rare condition these days, and there is more than enough in terms of capacity, competence, and experience to take care of bone fractures in Nigeria as we speak. You can go to any of the teaching hospitals, orthopedic facilities, or well-equipped private facilities like ours, where you can get professional care to ensure that your bones heal properly, they don't get infected, and you're able to get back to your life in no time.
Thank you so much for joining us on the program. We hope to reconnect with you subsequently. We have been speaking with Dr. Babajide Lawson, consultant orthopedic and trauma surgeon at Reddington Hospital, Victoria Island, Lagos State. This brings us to the end of the program. Just like Dr. Babajide Lawson has said, osteomyelitis, bone fractures, and dislocations are preventable. For comments, contributions, and suggestions on these episodes, subscribe and follow us across all of our social media platforms. Join us again for another episode of the program, Healthy Living on Trust Television. I'm Aisha Salihu. Thanks for watching.